សូមជម្រាបសួរនិងសូមស្វាគមន៍ជាថ្មីម្ដងទៀតនៅក្នុងកម្មវិធីសុខភាពឆ្អឹងខ្នងរបស់លោកអ្នកជាមួយ ICC នៅសប្តាហ៍ទី 2 នៅក្នុងសប្តាហ៍នេះផងដែរគឺយើងនឹងមកនិយាយអំពីប្រធានបទចាការព្យាបាលដោយចលនាបែប Chiropractic សម្រាប់បញ្ហាស្មា Hello doctor and welcome again for our second week and in this week our topic will be chiropractic care for the shoulder problem. So can you please let our audience know that what is the most seen problem in the shoulder that you have encountered during your work time?
Okay, to understand the shoulder issue, I must briefly review about the anatomy. So there's 4 major muscles which are included in a group with what we call the rotator cuff. So usually it's the main one is the subscapularis, which is going like this, the supraspinatus, which is just over there, and then on the back 2 other muscles, infraspinatus and teres minor. Usually the most common issue that we meet at the clinic is tearing or lesion on the muscle which is upper here, which is the supraspinatus.
So with this kind of problem, supraspinatus that you just mentioned earlier, right? What does it cause? Like with the symptom that the patient is experiencing?
Usually it's after a traumatism. Like for all the people, when they fell down or when they have a small hurting themselves, then it's going to have a small tearing on the muscle. Usually the patient cannot raise the shoulder, so they come and they say, you know, doctor, I cannot move, cannot go on this side. So we do the checking, the test to know which muscle is really implicated in this process. And then based on that, we probably might ask, depending on the condition of the patient, some echography or any other complementary exam in order to confirm which is the muscle implicated in that. Then we can propose the treatment to the patient.
I see. So how long does it take for this kind of problem to get treated, like with the chiropractic care?
Usually for the shoulders and another joint, the knee, it's usually the main joints that you use most of the time, like every day. So it might maintain the inflammation or the problem because you're using this every day. So it might take a bit of time depending also when the patient is coming. So that's why it's really important to don't wait with some pain on the shoulder, because the more you wait and the more you get you need time to get recovered.
I see.
So it can take some weeks depending again about the condition of the patient, the age of the patient, and also the activity of the patient.
I see. So usually what that means is that the patient who is younger tends to be healing faster compared to the older patients?
Yeah, usually that is the case. It's like when you take the example of cutting yourself. If you, let's say if a kid cuts himself, is going to recover in 2 or 3 days. But if you are, let's say, more than 20 years or 30 years, you cut at the same area, it's going to take 1 or 2 weeks. So because the system, when you get older, is the process of healing takes more time. So that's why we usually say to the patient to be patient, because usually when they get older, their system, their recovery system, also the nervous system is slower. So that's why we always do as fast as we can, but you know, sometimes it's depending on the patients.
Right. So usually with the problem in the shoulder area, it's always like require the chiropractic care, chiropractic treatment, or is it also going to be better with the physiotherapy modality?
Yeah, usually it's a good complementary treatment. The physiotherapy helps. We can add some laser therapy, or we can add also the electrotherapy combined. And it's usually after the treatment with the chiropractor, patients feels better. Like they can, you know, feel the relief with the hot pack and everything. So they go back home and with less pain.
ចា៎អ្នកទាំងអស់គ្នាអញ្ចឹងអ្នកទាំងអស់គ្នាបានស្ដាប់ឮរួចមកហើយពីប្រសាសន៍របស់ដុកទ័ររបស់យើងចា៎មិនថាអ្នកទាំងអស់គ្នាមានបញ្ហាដូចជាឈឺចុកចាប់នៅដៃសម្រានក្រោកពីសម្រានវិញហើយមានអារម្មណ៍ថាជាប់ដៃលើកមិនកើតឬក៏ បត់ដៃមិនកើតឬក៏សូម្បីតែពាក់អាវក៏ពាក់មិនកើតនោះចាសូមកុំភ្លេច ICC គឺនៅខាងយើងគឺយើងមានផ្ដល់ជូនជាការព្យាបាលដោយចលនាបែប Chiropractic ហើយក៏នឹងដាក់ម៉ាស៊ីន Therapy Modality ផងដែរដើម្បីជួយសម្រួលបន្ថែមប៉ុន្តែមុនពេលដែលយើងធ្វើការព្យាបាលមួយគឺដុកទ័ររបស់យើងផ្ទាល់គឺគាត់នឹងធ្វើការពិនិត្យមើលចាឲ្យដឹងថាតើបញ្ហារបស់អ្នកជំងឺកើតចេញមកពីអ្វីឲ្យប្រកបពីឆ្អឹងរបស់យើងផ្ទាល់ពីសរសៃឬក៏ពីសាច់ដុំដែលដុកទ័រគាត់បានពន្យល់អំបញ្ញមិញចាអញ្ចឹងចំពោះពេលនេះគឺបានបញ្ចប់ជាមួយនឹងវគ្គទី2របស់យើងរួចហើយចាហើយនេះខ្ញុំក៏សូមអរគុណអ្នកទាំងអស់គ្នាដូចគ្នាដែលបានតាមដានពីដើមរហូតមកដល់ចប់ហើយបើសិនជាអ្នកទាំងអស់គ្នាមានសំណួរអ្វីផ្សេងៗនោះគឺអាច comment នៅក្នុងវីដេអូរបស់យើងចានៅក្នុង page Facebook របស់យើងផ្ទាល់ឬក៏ឆាតចូលទៅក្នុង page ដើម្បីសួរសំណួរបន្ថែមពាក់ព័ន្ធជាមួយនឹងបញ្ហាស្មាមួយនេះហើយនេះខ្ញុំក៏សូមណាត់ជួបអ្នកទាំងអស់គ្នាម្ដងទៀតនៅសប្តាហ៍បន្តទៀតដែលយើងនឹងមានចាប្រធានបទផ្សេងទៀតដែលជឿជាក់ថានឹងផ្ដល់ជូននៅអត្ថប្រយោជន៍សម្រាប់អ្នកទាំងអស់គ្នាជាច្រើនចំពោះការថែទាំសុខភាពរាងកាយរបស់យើងផងដែរចាសូមអរគុណនិងសូមជម្រាបលា